Hello everyone, I'm Dr. Akshay Hari, consultant neurosurgeon and spine surgeon working at Aster CMI Hospital, Hebbal, Bangalore. Today I'm going to be talking to you all about a condition known as scoliosis. So world over, June is celebrated as Scoliosis Awareness Month. So what exactly is this all about? The aim is to bring or create awareness about this condition in the general public, and also to bring together those who are affected by it. So what exactly is scoliosis and why do we need to know about it? See, scoliosis is basically an abnormal curvature in the spine. Whenever we see the spine from the behind, it is usually supposed to be straight. But sometimes there may be an abnormal curvature in the form of an S shape or a C shape in the spine. That is known as scoliosis. So whom does scoliosis affect? World over, about 5 to 7% of the population is roughly affected by scoliosis. It can affect anybody, right from newborns to teenagers and even adults. In India, about 0.4% of the population is roughly affected by scoliosis. More so, scoliosis is a condition that affects children. Roughly about 30 to 40 million children in India are suffering from scoliosis. But not all scoliosis are the same. There are different types of scoliosis. One type of scoliosis is known as the early onset or congenital scoliosis. These children are usually born with scoliosis, and it is because of an abnormality that develops during birth. These children usually have an abnormally developed spinal cord or spine, because of which scoliosis develops. The next type of scoliosis is known as adolescent idiopathic scoliosis. So this type of scoliosis is the most common type of scoliosis, and it usually affects girls more than boys. The exact cause of this adolescent idiopathic scoliosis is not really known, but it is roughly known to affect about 70% of all types of scoliosis. The next type of scoliosis is known as neuromuscular or syndromic scoliosis. This is usually associated with children who are having some sort of a neuromuscular condition like cerebral palsy or a myopathy or muscular dystrophy or even polio, etc. The last type is the adult type of scoliosis. Now, this type of scoliosis can be because of an idiopathic scoliosis that has progressed onto adulthood, or because of a degenerative scoliosis that develops in the elderly age group. So how do we identify scoliosis? Parents usually might notice an abnormal deformity in the spine whenever seen from behind. Usually there might be some unevenness in the shoulders, like one shoulder might be higher than the other. There might even be some unevenness in the hips, so one waist might be higher than the other. There might even be a hip crease. Sometimes there may be a deformity of the ribs or a prominence of the shoulder blades on one side. Very rarely, children may present with pain. Although pain is not a primary symptom of idiopathic scoliosis, sometimes pain may also be associated with scoliosis. Very rarely, there might also be some other skin changes such as markers or excess hair growth, which may be seen in the lumbar spine because of an association with congenital scoliosis. So once you've identified scoliosis, the next step is to make a proper diagnosis. So if you suspect scoliosis in your child, the next step would be to consult a spine specialist who would then offer a series of medical checkups to diagnose the type of scoliosis. One of the tests that might be also offered are X-rays or an MRI or a CT scan to find out the exact type of scoliosis. Based on these tests, the doctor might then suggest further management options, which would range from observation if it is just a mild curve to sometimes bracing and physiotherapy for moderate curves. In very rare cases where the curves are really large or when the deformity is quite big, surgery might also be recommended. So therefore, it is very important to understand that a condition known as scoliosis is there and can be prevalent in children. And if you suspect that your child has got scoliosis, it is essential to consult a spine surgeon or a spine specialist and a group of doctors who can then properly diagnose the type of scoliosis and offer personalized treatment as per the condition. Thank you.